Welcome to the 2020 PDA Pharmacopoeia Conference. I am thrilled to introduce our speaker, Marilyn Stebbins, Professor of Clinical Pharmacy and Vice Chair of Clinical Innovation, University of California, San Francisco School of Pharmacy. Welcome, Marilyn.
Thank you. Good morning, and thank you for this opportunity to speak to you today. My name is Marilyn Stebbins, and I'm a pharmacist and professor of clinical pharmacy in the UC San Francisco School of Pharmacy. For all of us, 2020 has been a particularly challenging year on so many fronts. The COVID-19 pandemic has turned the world upside down and changed every facet of life, including social interactions, business, education, public health, and healthcare. However, as an individual who believes in the power of positivity, I must say that this is also an incredibly exciting time for science. The rapidity with which the scientific community has shifted its focus to solving the issues of the pandemic, including the immediate need for new treatments, using novel compounds, as well as testing already existing drugs, has been unparalleled. I also must acknowledge that I'm privileged to have access to evidence-based information and to some of the leading scientists in the world at my own institution, UC San Francisco, as well as the ability to have had training and background to evaluate the evidence and the information that's available today through all types of media. Unfortunately, the majority of the US and the world does not have this advantage. However, the reason I'm here today is to share with you my very personal journey as an early COVID-19 survivor and my intersection with the good, the bad, and the ugly of this crisis. So, by all accounts, life was really normal for me as I planned a ski trip at the end of February 2020. I'm a fit and healthy 58-year-old. I'm an ultra distance trail runner. I enjoy cycling, circuit training, and Pilates. I had completed a 30K the weekend before my ski trip, and 2 weeks after, I was getting ready for a 50K trail run. As a pharmacist and healthcare provider at UC San Francisco, the days before my trip were really pretty typical. I practice in a virtual post-discharge transition of care clinic. That's also a learning environment for PharmD students and residents. Although our clinic is virtual, we problem solve patient post-discharge medication issues in a small room on campus, and quarters are tight. During this period, I had no known exposure to any person that either had COVID-19 or was high risk for COVID-19. My fellow practitioners and I were very alert to the COVID-19 situation in China and to the news of all these passengers on cruise ships being quarantined. And we had 2 patients actually in our own institution that were being treated, and they were doing really well and were just getting ready for discharge. UCSF had been on the alert since January with their COVID-19 planning, and it was still 27 days from California's March 19th statewide shelter in place. So Saturday, February 22nd, I was getting ready to go on my ski trip. And as I was doing this, I noticed, I had some mild cold symptoms. And what do I do whenever I have mild cold symptoms? I took zinc every 2 hours and elderberry syrup because this was a great ski trip with powder skiing and a cold was not going to disrupt it. On the following day, that Sunday, I flew with my husband from Sacramento to Spokane, and we waited in the airport for 90 minutes and then rented a car with my brother-in-law, and we drove up to Sandpoint, Idaho, where we have a family home. The next several days, 2 days, we enjoyed amazing powder skiing 5.5, 6 hours a day, which is a lot longer than I normally ski. And so my muscles were sore and I was fatigued, but I was assuming it was just from overuse and really great skiing. And throughout our stay in Sandpoint, I was in close contact with my husband, my brother-in-law. We shared the house, chairlifts, great conversations, and meals. On our last day in the afternoon, I looked at both of them as we were going up our last chair ride, and I said, "Hey, is anybody else's lungs burning? Mine burned a bit." And both of them said, "Nope, not mine." And they looked at me and said, "But you're skiing really hard. We're at altitude and it's really cold." So I didn't think anything of it. The following day, we were coming home and flying back to Sacramento. And on the way to the airport, I suddenly thought, oh my goodness, I have food poisoning. I got horrific nausea, diarrhea, and I was a mess. It sort of waxed and waned, and I thought, okay, this feels like food poisoning. Got on the flight, came home, and later in the afternoon, I felt a bit better. And as a female who had broken a nail on the ski trip, I took a trip to my nail salon where I had my nail repaired, and my manicurist was wearing a mask, but I did not. At this point, again, I thought I just had food poisoning. Woke up Friday morning and thought a train had run over me. I still had the GI symptoms, but now I had severe body aches and chills, no fever. And I developed a bit of a dry cough, and my lungs continued to burn as I took a breath in, anything more than a normal breath. Although it had a flu vaccine, I knew that the flu season was particularly bad and the effectiveness of the vaccine wasn't as optimal as it is in some years. And I really did feel like I had the flu. So I called my primary care doctor, who asked me all the questions about had I been to China or Europe or in contact with anybody who traveled there. And I said no. And basically she said, "I'd like you to go to the emergency room and get a chest x-ray." And I said, "Really? You know me, I don't want to do that. Can I just come in and get an x-ray there?" And she said no. I said, "You know, the EDs are crowded with the flu. Can I please just go to the urgent care?" She said, "No, I really want you to go to the emergency room." After an hour of indecisiveness, I gave in and I went to the emergency room, and I had the same screening procedures, although no one was wearing masks and there was no PPE at this point. Again, all the same questions. Again, I had no fever and had not had a fever, and was taken back for an x-ray and was told that I had a multifocal pneumonia, but my vital signs were stable, and they thought I had community-acquired pneumonia. They gave me 2 antibiotics and came out and said, "You know, your chest x-ray is a bit bothersome. It looks really different than a normal pneumonia. You could have something underlying like a malignancy. We need you to go right away next week and see your provider and have them recheck your x-ray." And I kind of was taken aback and said, okay, and immediately called my PCP. And at that point, they gave me a mask and they said, "Wear your mask at all times." And I said, okay, I can do that. And filled my prescriptions, sent my doctor a message. She too said, "Well, that's strange that they said that." And she got me in Monday morning for a visit. As the weekend progressed and I continued my antibiotics, I got worse. I continued to be weak. My shortness of breath intensified. My body ached. I had chills. I had no fever. I started a probiotic to try to quell what I consider to be antibiotic-associated diarrhea. But I just couldn't function. I was sleeping 18 to 20 hours over that weekend each day. I told my husband, you need to sleep in the other room. I am really sick. On Sunday, I called a couple of family members who are healthcare providers, and they said, you have got to go to an emergency room. This is ridiculous. You should be better. Antibiotics, they should be working within 24 hours. You need to go. And I said, look, I'm seeing my doctor tomorrow, and I didn't go. And I continued to get worse. Monday, still no fever, intense GI symptoms, horrible shortness of breath and coughing. And every time I would cough, I'd throw myself into a spin of nausea and then just feeling like I was going to pass out. I couldn't climb my stairs. I was miserable. I went to the doctor and was still wearing the same mask that I was given that Friday before. Walked in, and they did another x-ray, which showed the same multifocal pneumonia, but this time my pulse ox was down to 93%, and it had been 99% in the ED the Friday before. And my doctor said, you know, I really think that you need to consider going to the emergency room because this is not going in the right direction. I went home, and my husband and I talked, and I said, I've got to go. I can't even get up the stairs. I'm so sick. Got to the emergency room, which I was seen very quickly. Again, I hadn't been eating or drinking for the whole weekend. Didn't know it then, but I had lost my sense of taste and smell. And I thought, at least if I go to the emergency room, they can give me some fluids and hydrate me, because I felt really hydrated. In terms of the COVID-19 situation in Sacramento at that point, the first community spread case in the entire country was at the UC Davis Medical Center the week prior. And again, this person was intubated in the ICU. And when I showed up, because I had no fever, I was not tested for COVID. They tested me for everything else, and they kept me in the ED. They gave me more antibiotics, and they moved me to an isolation room within the emergency room where I spent the night. And the next morning I had an ID consult, and they decided that after looking at all of my viral panels that were done and everything was negative, they said, you know what? This looks like it could be another one of those weird presentations of COVID without a fever. So interestingly, at 5:30 that night, I got COVID tested, and everything changed. Suddenly, I was, no one was allowed in my room. They had to all don and doff PPE, which at that point was the respirators. So they had the tanks on them and the headgear. They all look like beekeepers. I was told that I was going to be moved to the intensive care unit because there had been case reports of people looking fine and breathing fine, and then within 30 seconds needing to be intubated. So in the middle of the next day, they kept me in the ED at that point, but my COVID test came back in about 22 hours. And when it came back positive, I was instantly put in the ICU, where I was continued on supplemental oxygen and received oxygen, but I entered the glass of the ICU. And I have to say, the isolation is pretty intense, especially when your brain is still functioning, even though you're very sick. I was not intubated, but I was in a glass bubble, and people at that point did not have good enough PPE. And so they were very judicious about coming in and out of my room. Oftentimes they would talk to me over the phone, and my nurse would come in every hour or so, but it was really surreal, I have to say. at that point, infectious disease came in, and we started discussing whether or not I would go on remdesivir. At that point, I was case number 69 in the United States. So when you think of how many positive cases there are now, I was case 69. I was so early in this pandemic. And at that point, remdesivir was compassionate use. And when we talked about it, I said, look, I really do not want to be a guinea pig on this drug. Can we just see if my symptoms continue to improve? If you have a clinical trial, I'm willing to go into a clinical trial. And their clinical trial had not been set up yet. But we together chose not to go on the remdesivir. And fortunately, my breathing didn't deteriorate. And although I remained very short of breath and on supplemental oxygen, I would tell you my most severe symptoms at that point were GI symptoms and my intense headache. And interestingly, I was the first case in my county for COVID, and they designated me in their press release as an older woman with underlying conditions, which really bothered me from the perspective of, at that point, people thought the only people getting COVID were elderly patients in nursing homes. And I needed people to know that anybody could get this. I was a healthy, active athlete, and somehow I got COVID. And I really felt that it was misrepresentation. And I battled a bit with my health department, who did not change the designation until I published my story a month later on the UCSF website. And then they changed my designation to the first case in Yolo County was a woman. So I felt a bit unserved by my public health department. But another way that was so surreal in this entire situation was how they were going to get me home. First of all, nobody knew when to send someone home. My breathing continued to improve, but at that point, CDC was saying 2 negative tests 24 hours apart. They tested me in the hospital, but suddenly the results were not coming back quickly. And I didn't really need to be in an ICU bed. So they decided to send me home, but they hadn't figured out how to get me home. My husband was not allowed to be tested at that point. He didn't meet CDC criteria. So he was put in quarantine, and I was going home to isolate and quarantine. And how was I going to interact with my husband? I was really ill. I couldn't take care of myself. What was he going to do? They said, well, let's put him in a hotel for 2 weeks. And I said, but I can't care for myself right now. So we had to figure that out. And then they said, but how do we get you home? And you're not going to believe this, but the ultimate decision was that I would go home, someone would drop my car off in the parking lot, and I would be taken out wearing PPE to my car because I was still testing positive, out to my car, and I had to drive myself home 20 miles, which was crazy because nobody could figure out how to get me home. And the good news is I have a almost self-driving Tesla, and I put it on auto drive. But remember, this was early March, and we still didn't have shelter in place. It was a crazy situation. And I was told that public health would be the ones to coordinate my care along with my primary care doctor and continue to get me the care that I needed and the testing that I needed. Well, I wasn't contacted by public health for 4 days after I came home. And it was really disconcerting. And here I am, a healthcare professional with a lot of knowledge, and I was unable to navigate that system. I was in uncharted territory, and I was still testing positive. It was a crazy situation. And interestingly, the Department of Public Health told my husband he could come out of quarantine after 14 days, even though I was still testing positive. So the messages and the messaging were just not coordinated. And I don't fault anyone. It was just a crazy situation. I continued to be tested, and I tested positive for 77 days. And at that point, even though people really figured I probably was not contagious, I still felt like I was the virus, and I isolated. I even isolated from my husband. We didn't share a room for 3 months because of my fear that I was going to give this awful disease to someone else. And it was a really crazy situation. And what did I learn? First, I learned that patients feel an intense abandonment at times of uncertainty, and keeping patients well informed, which I have to say my healthcare team did, even when it was to say, we don't have all the answers, but we're working on it, was really important. The other lesson was when patients are symptomatic, navigating the healthcare system can be so overwhelmingly challenging. And it's our responsibility as healthcare providers to understand this and provide care with an empathetic as well as a clinical perspective. And we have got to get better at coordinating care in and out of systems and across systems. It has to be our priority. And I have to say, I think much of this has improved since the early days when I was there. But I still will tell you that the entire situation of so many people being sent home to quarantine and not going to the hospital who are sick are really left alone. What am I doing to help change? Well, I've been involved in 7 clinical trials. Many of them were the early antibody studies for the antibody tests. I'm unable to donate my convalescent plasma because I'm not big enough. So that frustrates me. But I'm doing multiple surveillance studies, and my husband and I are both in a partner study, because if you can believe it, even to this day, he has not been allowed to be tested outside of clinical trials because he was asymptomatic. But I will also say that as a pharmacist, this is an interesting world with COVID, looking at quick approvals of drugs for hydroxychloroquine to be used for COVID, and what we had to face with the shortages for people who had indications for hydroxychloroquine that couldn't get their drug. And with the ability to give people hydroxychloroquine, it became much more difficult to get people into clinical trials so that we could look at the safety and efficacy of treatments like hydroxychloroquine, convalescent plasma, remdesivir. If all of these are put out with emergency use authorization, fewer people go into clinical trials, and the science gets delayed. And sometimes the science doesn't occur because people can get the treatment without joining clinical trials. So I have to say, this experience has been humbling. It has taught me to look at information in a very different way, and to look at how the general public looks at information and misinformation. And I look upon it as my duty as a healthcare professional and an educator to share my story so it can be an opportunity for learning for others. And I'm very excited, first of all, and look forward to the topics that will be discussed at the PDA Pharmacopoeia, and look to see how all of you grapple with the challenges and the opportunities of the COVID-19 pandemic. Thank you very much.
Thank you so much, Marilyn, for sharing your story. I hope everyone enjoyed the presentation. I look forward to having you join us live Tuesday, September 29th. Thank you.